Okay, so today we're gonna look at the Quadratus Femoris. My name is Beth. I'm with Cantata Wellness, and every Tuesday I do a Technique Tuesday video, and here we are. So Quadratus Femoris is kind of a square little muscle. It comes from the ischial tuberosity and then comes across to the trochanter. So it's kind of a square muscle that goes here. Now, it can have an effect on the sciatic nerve, which kind of comes out and runs down here. Usually we talk about piriformis when we talk about the sciatic nerve, but Quadratus femoris is kind of right next to it. It's also a deep six lateral rotator, and it can be involved in sciatic nerve too. So as you're doing this, if your client has any burning or tingling or numbness that runs down their leg, then we want to adjust because we're probably on that sciatic nerve. So again, we're going to find that ischial tuberosity. We're going to find that trochanter, and one of the first things that we can do is just kind of bring an elbow in. Now, again, I want to avoid the sciatic nerve, so I'm going to just come a little bit closer to the sacrum, and I'm just going to kind of lean into this and lean into the ischial tuberosity just a little bit and see if that can bring some relief. Now, we're talking about hamstring pain. So remember that the hamstrings also insert on the ischial tuberosity. So if we can't resolve hamstring pain working on the hamstrings, the Quadratus femoris is the muscle to kind of go to. Now, another thing that we can do is find that trochanter. I'm going to put my hand just behind it. I'm going to bring the leg into just a little bit of lateral rotation and also adduction. Now, I'm going to kind of put my hand here. This is going to be my monitor hand. I want to make sure that we don't have any muscle spasming happening as we do this. And we're just going to hold and see if we get a release from here. And then the last thing I want to show you, I'm going to come around to the other side of the table. So we want to be able to laterally rotate our client's hip. Now, lateral rotation is going to go this way, and medial rotation is going to come this way. So we're going to kind of do a pin and stretch. So I'm going to just do a little bit of lateral rotation to engage the muscle. I'm going to find that trochanter, and I'm going to kind of come to the inside of it, and I'm going to drop down on the lower part inside, and then I'm going to bring the leg into medial rotation, the hip into medial rotation, sorry, and do a pin and stretch. Okay, so lateral rotation engages, we pin, medial rotation stretches. And that's a few methods that you can use for Quadratus femoris. Y'all have a great week, and I'll see you next Tuesday.